Welcome to Bare Bones. With your hosts, Dr. Mason West.
Welcome into this episode of Bare Bones. As always, I am Mason West. Normally, y'all get to hear me talk about, mock drafts, preview, post-game show stuff for the Chicago Bears, throw in my 2 cents when it comes to injuries, rehabilitation, things of that nature with the team. But I am very, very, very lucky today to be joined by Dr. Elizabeth Pieroth. She is a board-certified clinical neuropsychologist and the director of the Concussion Program at Midwest Orthopaedics at Rush. Previously, she served as the Associate Director of the North Shore University Health System Sports Concussion Program. She has been actively involved in assessing players in the National Hockey League and is the head injury concussion specialist for several major sports teams, including the Chicago Bears, Blackhawks, White Sox, the Fire, and the National Women's Soccer League. Dr. Pieroth is deeply engaged in concussion and brain injury advocacy. Bringing her in right now. Dr. Pieroth, how are you doing today?
I'm good, Mason. Nice to see you.
Nice to see you as well. I've been fortunate enough to meet you a couple of times and talk shop a bit, but I'm super excited to have you on today because I personally believe, as someone who gets to treat concussions, and I say gets to because I think it's a great population to work with, that it's a misunderstood group and oftentimes an underserved group. Agreed
on both counts.
Well, first off, how did you become interested in neurology, concussions, and the sports world in general that you're immersed in?
So it's interesting because everyone always asks me if I was an athlete, and I always say no. I'm actually quite klutzy and uncoordinated. My family called me Grace growing up, as in lack thereof. So I actually was doing my postdoctoral fellowship at Henry Ford Hospital in Detroit. And I won't say more than a few years ago. It was 28 years ago. And my mentor was a gentleman named Dr. Mark Lovell, who was one of the world's leading experts on concussion. And he was the coordinator and the creator of the program for the NHL. So in 1997, the NHL was the first year the NHL had a concussion program. They were way ahead of other leagues. And as Mark's fellow, I got to be brought into all of that. And when I came back to Chicago, where I'm born and raised, there just wasn't a lot of people doing concussion work. My background was in more severe traumatic brain injury. My practice started just to grow and grow because it just, again, weren't a lot of clinicians doing that work. So it was sometimes you just get lucky.
Right. Sometimes it's very lucky than good, but in your case, you're both. So that's a fantastic combination. I'm going to go with the obvious here. What is a concussion?
So, I always talk to my patients about making sure we understand what a concussion is because there's a lot of information out there, right? So concussion is a brain injury, first and foremost. It's in the medical term is actually mild traumatic brain injury. That's not to suggest that it's mild and to the symptoms that people have, but brain injuries are categorized as mild, moderate, and severe. And a mild concussion, a mild traumatic brain injury or a concussion is one where the injury occurs at the cellular level. So you may have a CT scan or an MRI done after a blow to the head. That's done to rule out more serious injuries like a hemorrhage or a swelling of the brain. A concussion we cannot see on a CT scan or imaging, any other test. It's really what we call a neurometabolic injury. So it's something we take very seriously, but fortunately it's something that is not life-threatening unless something changes.
And from a physiological perspective, why do symptoms sometimes take days to show up? And you see that oftentimes in the NFL. Sometimes a player does get back in there, and then a couple of days later, they're ruled out with a concussion for the remainder of the week and into the weeks going forward.
Okay, so I'm glad you brought this up because that's not actually true. Okay,
there you go.
This is one of those there's many myths. People always ask me what the myths. It's not true that concussion symptoms take days or weeks to develop. Okay, So generally, when somebody has a concussion, it takes about 4 to 6 hours. Okay. Let me explain a little bit. So, if you have a blow to the head, which is significant to cause a concussion, we do see sometimes delayed onset. So this is particularly true with athletes. I always say adrenaline can mask a lot of things. So we can see athletes and they have a lot of adrenaline and they're in their zone and they're focused on what they're doing. And it's after the game they start to have symptoms, right? Or we see people have car accidents, other things that are, again, scary and a lot of adrenaline. So what we know is that when those adrenaline kind of calms down, or when people start to do tasks that are a little bit more demanding, they can have symptoms. And we sort of even say if you have a concussion later at night and you go to bed, you get up the next day and you have some symptoms, that's consistent with concussion. But what's not consistent is, I had a hit to the head and I felt okay. I didn't have any symptoms. I was kind of, living my life. And then days or weeks later, symptoms start. It doesn't mean those symptoms are not real. And so I always want to be careful that we're not, dismissing or delegitimizing symptoms people have. If you tell me you have a headache, I believe you. It's just that it wouldn't be due to a concussion days or that happened days or weeks earlier. It's oftentimes, and Mason, you certainly know this better than I do, it's oftentimes the neck that is contributing to those headaches and a lot of those other symptoms. Now, in regards to NFL players, sometimes, I know people don't understand. There's a lot of things that go beyond the scene that people don't know about an NFL player. So it may be a fact that the player just didn't tell anybody and they were having symptoms. And later on, the symptoms persisted. So they told somebody, or they were evaluated and they looked okay. And then the symptoms started to evolve after the game. So there's lots of reasons why you may hear something after the game that somebody is not concussed, and then later you hear that they're in the concussion protocol. And sometimes players I put in the concussion protocol just to be careful, right? We will always want to err on the side of caution. So sometimes players are put into that protocol so we can monitor them closely and see how those symptoms evolve.
Yeah, it's both a gift and a curse when you're the one who gets to work with and treat these individuals, because just like you said, I mean, it is a very subjective thing with the reporting of symptoms, and you're hoping that you have someone that can catch certain things here and there, whether it's the sensitivity to light, to sound, all these different things. But yeah, absolutely, it's such an interesting process in terms of, and if we could have slide back what's going on in that magical blue tent that's happening on the NFL sidelines, what we could learn, what we could see. But when you're seeing a patient in your clinic, right, because you're seeing them, right, it's not immediately after, it's usually, like you said, a couple of days, maybe a week after. What does an exam look like, and what are you looking for?
So a couple of things. So one, I always start with asking them to walk me through what happened, because I really want to understand the mechanism of injury. So one, is it enough what we call biomechanical force applied to the head to actually cause a concussion? Because like I said, other things can cause those symptoms. And two, what actually happened to their body? So was there neck involvement? Was there shoulder involvement? Was there other things that may explain some of the symptoms, or that are injuries in addition to the concussion, right? And then I ask them, we want to understand if there's any loss of consciousness and there's any amnesia surrounding the event. And then I want to understand what their initial symptoms were. And again, people can have no symptoms initially and they evolve within a few hours, but most people have symptoms initially. And then we want to understand, are those symptoms suggestive of concussion or something else? And then, so we kind of walking through because you're right, I don't see people immediately, but I want to understand how that initial day of injury and then how that sort of, evolved that evening, the next day. Then we understand what evaluations they've had, what treatment they've had, what symptoms are persisting, what symptoms are not. There's a sort of a normal trajectory of recovery. So we want to understand if people are deviating from that, that normal expectations of recovery. And then we start to look for, if there's persistent symptoms, what may be the underlying cause, right? What may be contributing to those causes. And that's when I send a lot of people to people like yourself, Mason, physical therapists for shout out to physical therapists.
Yay.
For, treatment of cervical spine, vestibular therapy, for exertional therapy. There's lots of treatment that people will need for persistent symptoms. And that's always my take home message. And maybe we'll get to this later, but it's always about, concussions are treatable and there are things that we can do if people are having persistent symptoms, but you have to, I don't give checklists to my patients. I hate checklist medicine. I want to really understand their symptoms and the pattern, the triggers, what is helping alleviate some of those symptoms, what is making things worse, et cetera. So you really have to ask a lot of questions about the symptoms and not sort of just say, oh, still having symptoms, kind of wait and see how it goes.
So kind of parlaying off of that, we just talked about all the subjective, some of those symptoms that you're looking at. How do you measure things a little bit more objectively to know that your patients are improving and they're making the marks, like you're saying, going down the road to recovery?
So one of the things that from an objective standpoint, we also do balance assessment and visual oculomotor testing. So, we can see a lot of the symptoms that people have are being driven by visual stimulation. So when people are having vestibular ocular issues, when they're having symptoms from reading, looking at a computer, movement, all those sort of things. So we want to get an objective assessment of that. Do we see imbalance? Do we see deficits in the visual oculomotor system? And then we want to see also too sort of patterns of symptoms. So much, and this, Mason, so much of concussion treatment is really subjective, right? Like so much is reporting of symptoms. And, the data tells us that of all the things that we do, all the, fancy tests that you may have out there, really the thing that has the best correlation to actual diagnosis and recovery is symptoms. And that's why it's so important that our athletes and our patients be straightforward about their symptoms, because I don't, I always joke, I don't have any magic way to look inside your head and know if you're recovered. It really is important that we have a working relationship with our patients, that they understand that we're just trying to get them better. We're trying to get them back to their activities they love, sports they love, but we want to protect them first and foremost. So being honest about their symptoms is the singular most important thing.
Yeah, really highlighting and trying to create that circle of trust, whether it's with the patient, maybe it's a parent, maybe it's a coach, even that might be involved, right? It's so important, and trying to educate in terms of why we need to be on top of this and why you can't return back to your sport too early, but also find the driving force, right, for every individual person, because one person maybe wants to get back for the sport itself, another person wants to get back because of the social aspect. They miss being with their teammates, and that's important.
So I always tell my patients there's 3 reasons why it's important for them to be honest with me and all their healthcare providers about the symptoms. Is that one, when someone's recovering from a concussion, we know that there's what we call increased vulnerability. So what we don't want you to do is get hit in the head again. I mean, I don't want you to get hit in the head at all, but it's a general rule. But if you're recovering from concussion and you additional contact with the head, what we can see is those symptoms that you experience can increase and they can take longer to recover. So, I always tell my athletes, I want you just to recover and be done with this. I don't want you back in my office in 2 weeks because, you minimize your symptoms and you took another hit, right? But 2, when you do research on, asking youth athletes and high school athletes, and, why did they not tell us about their symptoms, is that they always say they don't want their team down, right?
Yeah.
And we love that about sports. We love the camaraderie and all the benefits of that. But interesting is, there's research across sports that tell us that when somebody is concussed and they're not recovered, they actually don't play as well. So, if you can't read the environment and respond to the environment quickly, you're going to, not bat very well. You're going to get, checked because you couldn't get out of the way. You're not going to, hit the soccer ball correctly. So you are letting your team down by getting out on the field before you're ready to, until you're fully recovered. And third, over the last couple of years, there's been a really interesting data suggesting that, when somebody, again, is not fully recovered from a concussion, we see that they have higher rates of other injuries, other musculoskeletal injuries. And so, again, if you can't read the environment, you can't get out of the way, you are more likely to be injured. And that may be you blow your ACL or you dislocate your shoulder, something that may be season or sport ending. So for all of these reasons, I say to my patients, particularly my athlete patients, let me just work with me, right? Like, I want you to go back to play. I want you to do these things, but I want you to not do so until you're safe and you're recovered, right? I always say to my patients, I don't like repeat customers, right? I don't want to see you back here. So, it's important to have that conversation with athletes. They understand this is the reason why we do all this, right? We want them playing, but we want them to be safe.
Yeah, absolutely right. We are in their corner. We want to be the one that they mention when they're accepting their MVP award because we got them on the field. We kept them there. So we're there for them. So, you mentioned this earlier. There's so many facets to treating concussions, whether it's what you're doing in your office, whether it's what, I'm able to do in the clinic. And I'm biased, of course, in thinking how important this treatment is as a physical therapist. But how has the treatment of concussions shifted, in your opinion, over the last decade, whether you're talking about youth all the way through, professional?
So it's so interesting because, I talk about this. I think, I did a TED Talk and I talked about this, my TED Talk about sort of the shift as when I, just a couple of years ago, when I was doing my training, we told people, take it easy for a couple of days. If you're really symptomatic, stay home from school, work, and then kind of ease back into activity as tolerated by your symptoms, right? And over the years, it sort of became this thing where, they told people to completely rest and don't look at a computer and don't look at a phone and do all those sort of things. And there was never any science behind that. And so this became such a problem in the world of concussion care that there's been a ton of research, and I mean a ton, looking at this issue. And what was really clear is that sometimes old school ways are the best. Is that what we know is that you don't need to rest in dark rooms. You don't need to avoid stimulation. You don't need to not look at your phone. And I was the side eye that kids give their parents when I say this in clinic, because they've been taking their phone away from them for 2 weeks. But the idea is about symptom management. What are your symptoms and how do we manage that, right? So what has really changed is that it's really more about active rehabilitation, right? Yeah. So we're intervening sooner and we're moving people sooner. So even the day after a concussion, we start to move people slowly. We don't say go back to practice or anything like that, but we start to have them go for walks. We start to increase their activity. And that's one of the many jobs, and I'm going to go again, shout out to physical therapists, but, and is that one of the real benefits of treatment is that you're doing the exertional component, right? We want to treat those autonomic nervous system dysfunction. We want to prevent deconditioning. We want to prevent all the problems that comes with athletes when they suddenly stop to move, right? We see mood issues, we see sleep issues, and we want to prevent that. So we want to keep people moving sooner and really have an active rehab mindset.
Yeah, it's treated similar to a muscle, right? No, I don't. If you strain your hamstring, I don't need you to go run 5 miles, but I'd like you to do some loading of that hamstring in order so we can progress. Same thing when it comes to loading your brain and those other systems. And
I think that for me, what I always tell my patients is I think that the confusion came is that, when people, let's say, look at a computer, they may have symptoms. And that's for sure, very legitimate. And so the beef was that the brain activity was the problem. But what we now know, it's not the brain activity. Your brain is active 24/7. It's the eye movement that bothers people. It's that vestibular component. And so we want to separate that and say, it's okay. I always say, you're not going to melt your brain by using it. You're not going to make the concussion worse. But if you're on your phone or on your computer or laptop or, tablet or whatever, and you're starting to get symptoms, take a break, right? So we're encouraging people to be active while still listening to their body. So it still goes back to, like I said, increasing your level of activity as tolerated.
And so that was more, the treatment side. What about maybe like the cultural shift that's happened in terms of the conversation around concussions, where it almost seemed like a taboo thing, whether it was, again, within locker rooms or within professional sports, but now it's, seems like it is more, it's okay to have this conversation. It's okay to admit that, hey, I did get a bonk on the head and I lost consciousness for 5 seconds.
Yeah. So it's really been a shift. I remember when I started doing this work, back in the late 90s, we used to beg people to care about concussions. I remember having conversations with, kids and adults about well, a concussion is a brain injury. It's important. We like your brain. We want to protect it. And, you get the dad of, I had 12 concussions. I'm fine. Right.
Yeah.
Unfortunately, we hear that less and less. Only occasionally I get that. But we certainly don't hear that very often at all anymore. And so it's been a great shift because, do we sometimes have the opposite where people are, really scared of any contact of the head and those sort of things? And we can manage that, right? I would much rather have a conversation with somebody about the fact that they're okay than someone who's ignoring brain injury, right? So I'm okay with sort of the hypersensitivity to concussions. And I really have seen a huge shift in athletes. I remember the first year in '97, we were testing the NHL players. There's a lot of pushback. Players weren't happy about it. They didn't understand, right? And now, they just know it's part of the sport, right? They just get it. And what's interesting to me too is I find that the veterans are much more open to it, right? They understand. Looking at, and they're probably obviously nearer to the end of their career than a rookie, and they're looking long term, and they're looking at their families, and they're looking at their careers after the NHL, NFL, MLS, whatever. Where the rookies are, understandably very focused on just making the team and staying on the team. So sometimes it's a lot more education to say, like, listen, I want you to stay on the team too, but I want you to be healthy, right?
Yeah.
So they ask a lot more questions. I just remember a lot of athletes like nodding their head at me like, okay, whatever, lady, I need to get back on the field. Okay. Where now, we have great conversations. They ask a lot of questions. They come in with questions. And I will always ask too about I always want to know who's chirping in their ear. Is their mom, girlfriend, dad, sibling freaking out, about this concussion? And so I want to understand where they're coming from about their level of anxiety and, how other people in their lives may be, contributing to that or not.
Taking a shift a little more specifically to the NFL, I, as weird as it sounds, absolutely love the offseason with everything that goes with it, with the medicals and the combine and all that stuff. I'm a sucker for it. And I know you consistently speak at events such as the NFL Combine. What are some of those discussions like, to take us behind the curtain a little bit?
So to be clear, I sit on the NFL Head, Neck, and Spine Committee. That's why I will be at the Combine in 2 weeks.
Time flies.
And so it's interesting. I obviously can't speak specifics about what we talk about, but I can say it's very, very, very data driven. Dr. Alan Sills, the Chief Medical Officer for the NFL, has really done a wonderful job, in my opinion, looking at the data. So the NFL uses a company called IQVIA, and we have it's a data person's dream, what the information that we have. We can ask IQVIA to tell us, and every Thursday game when it's raining and and it's the wind's blowing in the northern direction, tell me about injuries. So I exaggerate, but we can look at everything that we think may be contributing to the injuries, and so we can really start to tease apart, where do we think where are these injuries coming from? What ways can we lessen these injuries? Looking at technique and equipment and all those sort of things. And the NFL uses long-standing what's called engineering roadmap, looking at studying how every concussion happens. They reenact each injury and looking at the forces. It's absolutely fascinating work. I love the meeting every year because I'm a data dork. So I like hearing all these information. So the decisions are being made by, a room full of experts that are really driven by data. So it's exciting stuff.
That's super exciting. I wish I could peek in that room. That would be I could nerd out. That'd be so cool.
I totally nerd out every year.
So unfortunately, you see players sometimes get recurrent concussions, right? One player specifically, Tua Tagovailoa, he's probably right now on the poster child, for better or worse, because he's had 4 concussions, 1 in college, 3, I believe, in the NFL. Week 2 of 2024 season was his most recent one.
Yeah.
Is there a time where an athlete just has had too many concussions? And if so, is there a checks and balances by teams or the league, or is it simply, this is a player decision?
So no, it's never just a player decision. It's always a group decision. But, I always tell people the number one question I get asked all the time whenever I do talks is, what is how many concussions is too many?
Yeah.
And we just don't have that information. We just don't. Because, as someone who works with concussion patients, Mason, you can appreciate this. There's just so many individual variables, right?
100%. Yeah.
So it's not, it's not only number of concussions, but it's also proximity, right? I just had this discussion with a patient yesterday. If you tell me, I fell out of a chair when I was 2 and I had a concussion. And then I, bought my bike when I was 10, I had a concussion, and now I'm 28. That's a very different clinical profile than somebody who had a concussion in 2022, 2023, 2024, right? Like, we get very concerned when we're seeing that somebody is repeatedly concussed, particularly in the same activity. So, if you're repeatedly concussed in a sport and activity, the likelihood you're going to continue to be concussed, is significant. Not guaranteed. People could then go on and never have another concussion, but we have to look at all those variables. But we also look at a number of other factors, and I would say there's sort of 4 things that we look for to suggest someone should medically retire from a sport. And this is the same conversation with little kids up to pros, right? Is there increased vulnerability? Is lesser of a contact causing a concussion? So, they'll say it wasn't that hard of a tackle, or it wasn't that hard of a check, or, I just headed a ball in soccer or whatever. That's a red flag. 2 is, are we seeing increased recovery time, right? So someone's just not bouncing back, right? The third is, are there persistent symptoms? So for me, one of the real big ones is post-traumatic migraine. Okay. I always say to people, if your brain is responding to trauma with migraines, you need to stop traumatizing it. Okay. It's, migraines are a quality of life issue. And 4 is the number of concussions. And again, there's a big, difference between not just a number, right? And I'm certainly not suggesting that 3 or 4 concussions is nothing to be worried about. I've had people that had 2 concussions, and we said they should stop playing the sport because of things like, starting of migraines as an example. So, and then you do have to look at the risks and benefits, right? Because like you mentioned earlier, there's enormous benefits of sports for kids. So, I never want to pull the rug out of someone's life, right? So, I often will say, let's say timeout, for a kid, like, okay, you're done for the season. Okay. And we're going to revisit this, right? Yeah. So before next season comes in, let's talk. And I would say 80% of kids don't. They just move on, right? They play a different sport, or they do a different activity or whatever. And about 20% come back and say, I really miss wrestling or hockey or football, whatever it is, right? And then you have a conversation with them about how they're doing, cognitively, academically, socially, emotionally, physically. You talk about all these things. And then you can say, okay, what are the pros and cons here? What are the risks and benefits? So, these are lengthy conversations that should never, ever, ever be boiled down to 3 strikes, you're out, right? 3 concussions, you're done. Particularly in kids, because if you tell a kid 3 strikes, you're done, they won't report their concussion.
Absolutely.
They don't want to use a strike, right? And so that's the opposite of what we're trying to do. We do all this to encourage kids to report their injuries. So it's never, ever, dark, black and white sort of thing. It's a pretty nuanced conversation that you need to have, because these sports are important to people. Yeah. They give real value to their lives, and I want to honor them as athletes. And so we don't just sort of say, like, okay, you've had this many concussions, you're done, right? And then, particularly with the younger kids, we also talk about, okay, maybe you can't play soccer or football or hockey or anymore. Is there another sport you love? Can we shift that love, that athleticism into something else? Maybe it's theater, maybe it's art, maybe it's something, right? We all want our kids to be healthy and happy and engaged in things they love. And maybe it's no longer, football or lacrosse, it's now theater, right? So we need to make sure that we're looking at not only the long-term neurologic care, but their psychological care, well-being as well.
I love that idea of redirection, essentially, right? Because sometimes even that kid now has a negative emotion associated with that sport because of the trauma that's just gone on with being in the lineup, out of the lineup, all that. So, hey, that is, even if you can go back, maybe that's just not for you anymore. Let's get you to doing something that you are still passionate about.
Yeah, it's interesting because I've had kids who, then transition to be the team manager, right? And then I have some kids who are like, if I can't play, I don't want anything to do with it. Yeah. Okay, there's no right or wrong. It's just about making sure that you're healthy and happy. And if being around the sport in some, equipment status or whatever brings you joy and it still allows you to be around your friends and active, that's great. But we just really want to make sure you have that conversation.
When it comes to football specifically, and whether this is anecdotally, just with what you've seen, or even like referencing some of the talks with, NFL specifically, is there a position more susceptible to concussions on that football field, or is it just really, like you said, time and a place and just however it tends to happen?
It tends to be, it's interesting. If you look at the data, it really depends on a number of things. So as an example, if you're a quarterback and you have a bad O-line, you're more likely to be concussed. I mean, look at how many times, Patrick Mahomes was sacked in the Super Bowl, right? Last weekend.
Yep.
And so there's that, right? There's all those sort of variables. But we also know, interesting, the data tells us that there are different types of concussions for different precisions. So as an example, quarterbacks tend to, get sacked and hit the back of their head. Okay. So one of the things that we're seeing now is development of position-specific helmets. So there's more padding in the back of the head for quarterback. Where things like the, center and other people who are in the front, they get a lot of more of smaller hits, but more of them, right? So they need more protection in the front of the head, right? So then you have people, those sort of speed positions, right? The running backs and tight ends, and people who have higher velocity hits, right? Because they're running and someone's tapping them. So it's all of those factors that go into sort of, risk for concussion. And then when it comes to kids, it's also, not only your position, but how much you're playing. This is just my bias. I hate when kids play both ways. I know people, think it's so cool, but man, you're out the whole time. You're really increasing your risk of injury, right?
I would have not liked you when I was in high school. I never left the field, so.
But it's interesting because, you get these kids who start to get a couple of concussions, and, maybe their parents want them to stop and they don't want to. And I'm always like, listen, I like to scale analogy, right?
Yeah.
So I always say there's a risk and there's the benefit. And the benefit's real. And I always say I honor you as an athlete. And there's all these benefits of sports that we know, they're well researched. But here's the risk, right? Here's your concussion, and this is your particular medical and psychological history, your family medical and psychological history, your academic history, your goals. If we're here and I'm like, maybe your parents are right, you should stop. We go, okay, can we lower this side? Can we lower that risk? And in football, that means oftentimes not playing both. So I'll say, pick a side. What do you like better, right? Or sometimes it's like, okay, you're going to be second string. You're just not going to play as often, right? Or, I had a patient once who happens to be a neighbor who got a lot of concussions, so he became a kicker. And I'm proud to say he's, going to be playing kicker in college.
Yay.
So it ended up being a really good decision for him. So, it's not black and white. And that's always what I want to stress is that if you or your child are going through these things, you need to sit down with someone who's experienced with us, who understands athletes, understands the psychology and, mentality of athletes, so that we are helping them make a decision, right? I always want the athlete to walk up and go, okay, I've been informed. I understand where the science is. I can make a decision based on that, not on fear or misinformation or emotion. Okay. So I will also tell people, don't make a decision about retiring from a sport in the throes of a concussion, because you tend to be more emotional, right? Not that I'm dismissing the symptoms, right? Certainly. Don't make a decision about returning in the throes in the playoffs, because your emotions in the other direction, right? So you need space and time. You need to kind of look to say, can you fill that void with something else? Or is there ways of keeping you safe, first and foremost, obviously?
And one of the things you just mentioned in there was, that collaboration between different professionals in terms of helping make these decisions, right? Treating concussions, whether you're talking about youth, professional athletes, like most injuries, involves a multi-professional decision tree and requires collaboration. So I've discussed this a little bit on the show, but, can you walk listeners through the process of clearing an athlete for play and how you balance the patient health with the desires of, athlete, parent, coach, et cetera?
Yeah, that's always a tough one, right? And so, I would say there's three things we look for to suggest that someone's recovered from a concussion. And one is they're asymptomatic, without symptoms, at rest and with exertion. And that's why we have this stepwise exertion activity to try to catch what may be triggering the symptoms, right? 2 is that their neurologic exam, particularly their balance and ocular system is normal. And 3, that their cognition, their thinking is normal. And, I would say it's kind of like three legs to a stool. People, you got to have all 3, because people can legitimately feel okay, but then their cognitive score suggests they're not recovered. Or somebody looks normal, but they're, in balance, not in cognitive testing, but they're still symptomatic. So we want to make sure there's all 3. The problem, again, becomes that one part about symptoms gets back to the importance about being honest, right? And I also do tell parents all the time, listen, those are the 3 things that we look for recovery. Again, from the little kids all the way up to the pros. But because just like I don't have a perfect way to know someone's recovered, or someone's had a concussion, I don't have a perfect way to know someone's recovered. I can't look inside their brain and say, yeah, recovered. And we don't have, besides, even though there's been millions of dollars looking for this, there is no what I call holy grail of concussion assessment or recovery. And so I always say to the parent, listen, even if they've met these 3 goals, if you feel that they need more time, then that's fine, right? Like, this is not the Super Bowl. This is not the Stanley Cup. This is not, the World Cup. We want to get your kid back and then them never be back in my office, right? So it's okay to sort of stretch out that return to play, particularly with younger, with kids, or with kids who have, more than one concussion. It's okay to be conservative.
There has been a push, right, to make sports like football safer. And one way is some external apparatuses, such as cue collars and guardian caps. For those who don't know, cue collars, you might have seen various players wearing them, that little apparatus around the neck that kind of looks like a more modern, sleek pair of headphones. Right now, they are boasting a 66% reduction in the likelihood of brain damage from contact sports over a season of play by increasing blood volume in the brain's venous structures, reducing the harmful internal movement that causes brain injury. What are your thoughts on cue collars specifically?
So I don't support the cue collar.
Okay. I don't either.
Okay, well, then we're the same. Okay.
It seems silly.
Yeah. So for a couple of reasons. Is that one, I always tell people all the time, be very, suspicious about any research that's being done by the manufacturers. Okay. And I'm not suggesting that their research is not correct or, falsified in any way. I'm not suggesting that. But you really need, independent peer-reviewed journals. It's research that's showing that effectiveness. And we just don't have that yet with the cue collar. There are certainly concerns about, reducing the blood flow to the brain and other negative consequences, and most importantly, for the kind of the most of the patients that you and I see, Mason, is that there's been no research on kids.
Yeah.
Okay. I have 2 sons, one who played football all the way through high school. I would never put it on my child. Okay. And that's as of now. Okay. I always keep an open mind because things do change and things evolve. But right now, I don't feel comfortable with the research that it is preventative and that there's not some negative consequence. Again, keeping open mind, if further research shows that those things are effective, I'll tell everyone in the world to go out and get a cue collar. I always tell people, I'm just a clinician. I don't have any, I'm not an inventor or an entrepreneur. So I don't have any competing products, right? I just want we all do. I want our kids to be safe and recover well. And if any of these products do that, that's awesome. But right now, I can't support that. The guardian cap, similarly. Okay, so there's been 2 years of data in the NFL that has shown a reduction in concussions. And again, I've seen this data. The data is well done. The people who are studying it know what they're doing. So I have no doubt the validity of that research. But the research done on kids to date has not shown it to be effective.
Yeah.
Okay. Again, you heard me say to date. That's always right. Keep an open mind, because the guardian caps that the NFL players are wearing are different than when you can buy off the shelf. They've been fitted differently. So there's one issue. 2 is that typical NFL players have very large necks and very large shoulders. So it doesn't matter if you add a little bit more weight to the helmet for them, right? They can manage it because it's just neck and upper body strength. Well, anyone seen the kids with a helmet, it's very hard for them to manage that weight of the helmet is, and now you've added to it. So always the concern is, are you adding risks of neck injuries? Now, again, the NFL has looked at that. They have not seen any more increase in cervical injuries with the guardian cap. So I think that's important to say. But I want to, it's not exactly apples and oranges. You talk about the bodies of NFL players and high school and youth players. The other thing that I worry about is heat dissipation. Is that, particularly in our southern states where we always incredibly worried about heat stroke and heat illness, is, you putting something else on that not only adds weight, but it reduces the amount of airflow. And again, in the NFL, we have not seen that. We're not seeing increased rates of heat illness with them. But there's about 4,000 people on the sidelines of any NHL practice and game. So looking at these athletes, medical professionals, it's just not the same for, kids across this country. They just don't have the same level of monitoring of their symptoms. So until, again, I see some better data, it's not something that I would support. And I will tell people, you can believe, and you imagine I've been asked this question many times. I tell people all the time, if your football league or team has extra money, go hire another athletic trainer, right? I would feel much more comfortable having an athletic trainer on the sidelines to help these kids and monitor, the injuries than putting unproven technology on them. Particularly because I don't want, and high school kids, what I don't want is them to put this guardian cap or Q collar or anything on their head and then now think they have, some extra super layer of protection that they can play more aggressively. So, it's again, like everything in life, right? It's a balancing act of risk versus the negative consequences.
Yeah, there was a study, I'm sure you read this one, that was published this last month by Hammer et al. In British Journal of Sports Medicine. They looked at 2,610 athletes from 41 Wisconsin schools, and they found that guardian caps used during practice in high school American football players was not associated with a decreased risk of sustaining a concussion in practice or games. So.
Right. And yes, I feel like that study, and that's one of the things I'm talking about. Now, to be fair, right? I always want to be fair. It's not only certainly the concussions that we were about, it's about the repetitive contact as well. So, having some protection to the head, does that lessen the repetitive contact, right? So that's something else that needs to be studied. Again, not suggesting that means that people should be running out and buying guardian caps, but I want to be fair and say it's not only concussions that we worry about. It's also repetitive contact to the head.
And to those who are, sitting at home or listening to this podcast and wondering, well, why don't we just make studies where we look at this in youth athletes? We now need to look at the methodologies and ethics of how we set up a study to have these young individuals bash their heads around. So there's a whole layering of that too.
Yeah, you're never going to get that past an IRB to bash heads around. And here's the truth is that this is true for any body part, any injury. There's lots of money at the pro level and the collegiate level, particularly D1 collegiate level. Less money for, studying of high school kids and particularly youth athletes. So there's just a paucity of research in that population. Yeah. And so what happens oftentimes is that people take the research from, let's say, NFL players or, D1 collegiate players, and they sort of, just sort of water it down and say it applies to kids. Well, kids are not many adults. They're very different developmentally, physically. So we have to be careful about making, assumptions based on research that's done with adults.
Yeah, every time I wake up in the morning, I can tell you I am for sure not 16-year-old me anymore. That is 100% the case.
I'm just trying to be happy if I get out of a chair without making old lady noises, So
that is a win. A lot of listeners of this podcast have kids who are thinking about playing tackle football amongst other sports or are currently playing. What is the earliest you would suggest allowing children to play tackle football? And are there any other nuggets you would tell parents of these kids?
So, what I always say, first and foremost, I have no interest in trying to talk anybody into letting their kid play or not play a sport. Okay. My job is to educate them on what the science is and help them kind of understand their kid, their family, their individual needs, right? Because it's so individual. And I'll give you an example of my own two sons. So my oldest son, like I said, played through high school. And it was a perfect fit for him. He had the body type. He had that big neck. But everyone looked at him and goes, lineman, he just has that body type, right? And he loved the physical contact. That was just, he loved the camaraderie, the boys, right? He loved everything about football. And he just didn't love any other sport. He played hockey too, because my husband plays hockey. So my kids play hockey. So as soon as they could stand up, they're, little skates on them. But it just was a fit for him, his personality, his body type, and his interests. But you might imagine that was a bit of a thorn in the side of the coaches when he was playing, that make sure that they were playing safely and they were following the rules, etc. So it's not I always say it's not a blank check, right? Just because you let your kid play a sport, you can change your mind if you feel like their coaches are not, teaching safe rules, or if your kid is being injured, right? You can just say, "Why did you try? It didn't work out," right? But what you can't do is say, "Oh, I'm only gonna let my kid play tennis." My kid would have never played tennis. Never going to happen. Okay. Where, my younger son tried football. He's a smaller body type, kind of long legged, lanky kid. It just wasn't his body. He didn't have the body type nor the interest. He played hockey and now he plays volleyball. Right. And so, which is what we love. We all want our kids to kind of try different things and do different things. And we just don't know what's going to really light their fire. So, educate yourself on the risks, educate yourself about how we're trying to reduce injuries. Because also keep in mind, football today is not the football of years, in the past. There's an enormous amount of changes to rules and practice and how much contact it is and equipment. And, it's not the same as when, the dad played or whatever. But ultimately, if you look at everything and you just don't think it's a good fit for the child, then that's a decision you should make, right? But make sure that your information you're getting is actually based on science and not fear, right?
I think that's an excellent ending point there. Well, I've taken up way too much of your time, and you've been awesome in this last 45 plus minutes. If someone in the Chicagoland area has suffered a concussion, their kid has, their neighbor has, whatever it may be, how do they get care from you?
So you can just go to Midwest Orthopaedics at Rush and put in my name, and there I am. Or you can call 708-236-2775. I think that's the number. I get it right. Sorry for somebody if I just gave out the wrong number. But I will say too, I also have what's called an interjurisdictional license. So I'm able to see people through telehealth in 42 states, which is nice.
That's awesome.
Yeah, so I can, help people who are not within the boundaries of the state of Illinois.
I know I have felt very, because when I first met you, I was working out in Barrington, and sometimes getting people to go to you was a bit of like pulling the leg. But now the fact that I'm in the West Loop, you're right where you are. I feel very fortunate to have you as a resource to send, some of those people who, if I just get direct access, right? Someone with those symptoms, and I'm like, you know what, I need another set of eyes. So I feel very fortunate to have you in my corner. And if you're listening to this, and unfortunately you're dealing with what we've been talking about for the last almost hour, there's no better place to go.
Oh, thank you. So I do see patients in Chicago, Naperville, Westchester, Oak Brook, and telehealth. I'm all over the place.
There you go. There's no reason not to see you.
Oh, thanks, Mason. I appreciate that.
All right, we're wrapping up here. Thank you, Dr. Pieroth, again for your time. I can't thank you enough, and we'll chat soon.
Oh, it's good to see you. Bye. Have a good night.
You too. Well, thank you everyone for tuning in to that episode of Bare Bones. It was a fantastic time, right? And again, I can't thank Dr. Pieroth enough for her expertise and what she was able to throw out there. It's one thing for me to chat about concussions and the clearance of athletes, but it's another to have her be able to pop on here and have that conversation. So again, if unfortunately you have to deal with that, there is no better resource out there. And if you need anything, that next step, like let's say it is a concussion and there is a cervical involvement, headache, dizziness, nausea, vomiting, all those things, first get that checked out. But you can also come into a physical therapist that specializes in concussions, right? Because there is direct access. You can see that physical therapist, and most of us are pretty good at being able to say, you know what, you need to maybe go to this healthcare professional first and then come on back after that's cleared. Or if not, you can dive right into the treatment and try to get back sooner. Because as Dr. Pieroth said, it is not, don't go in a dark room. You're not sitting there, lights off, no phone, no TV. Like I said, treat it like a muscle, right? Slowly, progressively load it in a way to get you back to doing what you want to do. All right, that's all I got for today. Bear down, everyone.